Welcome to RCC show presented by Yuvaap. Today we have Charmaine D'souza, who is consultant nutritionist with more than 30 years of experience, and she has also authored many books on health and fitness. Welcome, Charmaine ma'am.
So thank you so much. And at the onset, I'd like to thank everyone who has joined in. And today we are going to do an entire session on how you can, be metabolically active, how you can be fit, and most importantly, maintain your blood sugar levels. Okay. So if not yourself, probably your parents, someone in the home who has diabetes can definitely benefit from what we are going to talk about today. So
Right, ma'am.
I started my career not 20 years ago, but 33 years ago. Very soon it's going to be like June of 2023. It will be
Okay.
33 years that I have been practicing in this field. I'm guessing some of you might
Wow.
not even have been born at the time, but
Correct.
it's been an absolute long but satisfying and successful journey. And when I say successful, I don't mean monetarily. What I mean is successful in the terms of seeing so many people improve their health through simple healing methodologies. So simple things from the kitchen, because I practice naturopathy. So very, very simple herbs and spice combinations from the kitchen, which you can take on a daily basis, which, because you're dealing with a naturopath or someone who's qualified, will be able to guide you as to how you can do things which will be more beneficial to your system rather than being detrimental. So everyone has that dadi maa ke nuske, etc. Everyone knows something about how you can take haldi and you can kind of use that as something to help prevent coughs and colds. Everyone
Correct.
uses ginger. Everyone uses different therapies. But it is also important, and I always have patients who ask me, but it is natural now. What can happen? Now, the very simple thing, and at the start of it, okay, so before we can even go into what is diabetes, etc., the very, very simple thing is to understand when you are taking something, natural or artificial, just as there is a good thing that can result from it in terms of, say, for example, relieving you of your cold or helping you to increase your metabolic rate or bringing your blood sugars down, there are also contraindications. So I'll give you a very simple example. Recently, during the pandemic, anybody and everybody was taking ginger. Why? Because it was said, and people put out WhatsApp messages, they did videos
Correct.
and whatever, that just taking ginger will prevent COVID, right? So unfortunately, there were people who were also shoving ginger powder,
Yes.
sunt, right? Naak mein. So they were just putting it into their nasal openings and thinking now COVID nahi aane wala hai. But the most
Correct.
important thing to remember is, first of all, pushing that ginger powder in the nose uh, caused nosebleeds because it totally broke up the membranes from the nasal cavity and was detrimental to health. Then others who were drinking gallons and gallons of ginger juice, but say for example, someone had high blood pressure or someone was on a blood thinner, okay, because to prevent the clotting, etc. And they were also taking ginger juice, then that ginger juice was preventing the action of their medication, which was a life-saving medication, not for COVID, but for the other disease conditions that they have.
Correct.
So they're taking the tablet, thinking now the blood thinner is doing its action, but they're also taking ginger juice, ginger ka pani, ginger tea, and whatever else through the day in amounts that were much more than what they needed. So what was happening then is that the medication was not acting in the way it was supposed to act because ginger was acting antagonistically with their medication. And the fallout was ill health. So whenever someone tells you, but it's natural, nothing can happen. Nothing can happen if you meet those parameters. But something can definitely happen if there is a medication that you're taking and that herbal or natural or whatever food, herb, spice is not acting well on that particular medication. So whoever gives you information or whoever tells you take this has to have an idea of what you're currently having. Another very simple example, a couple of years ago, Doodhi juice was like the cleanser, the detoxifier, and you lose weight, etc. But Doodhi also brings down, because of the sodium, potassium, etc., it brings down your blood pressure level. So if someone who has high blood pressure is taking Doodhi juice, they'll benefit. And they will even go and glorify दूधी juice and tell everybody, सबको बताएंगे कि दूधी juice रोज सुबह उठते ही दूधी juice पियो क्योंकि blood pressure कम होता है. But somebody in the house, the same house where दूधी is being made 6 बजे से लेके 8 बजे तक, everybody is making दूधी juice. There is a young child, there is a daughter-in-law who's pregnant, whatever, who already has low blood pressure. Then she is drinking दूधी juice and her blood pressure goes even low. There have been cases where people have reached the ICU, people have died. And then what is the headline in the paper? दूधी में कुछ poison है, इसीलिए you have to know. So people are not understanding. People are not understanding what exactly needs to be done. What are the combinations? Because they have no health background. They have no biochemistry background. So one thing worked for them. They want everybody to use it, but not understanding what the other person's blood chemistry is, what the other person is in terms of taking medication, etc. And as a result, some things which so-called natural, etc., can be harmful. So not to put out a wrong message, but to just simply state that whenever you're starting on anything, and that is the reason why we constantly say that whomever you're contacting, contact a qualified practitioner, someone who knows your family history of disease, someone who knows your history of disease or ill health, and only then look at things. So that is also the reason why we do not on an open forum tell everybody sub ginger ka juice piyo or haldi ka ye le lo, whatever, because it can be harmful to few people, right?
Yes.
70% of the public may benefit from it. But what about those 2 or 3 or 5 people who fall ill because of that? So that is the important reason, to understand, to find out from a qualified person, and then go on and use that particular therapy.
So it is important that we practitioners should know everything about your history and everything. Then only you
your
can
personal
take
health. Very classic example, and I have hundreds of examples because, like I said, 33 years of practice. So there was this boy who came to us.
Correct.
A boy who came with his mother, 33-year-old, very low testosterone levels. वो injections ले रहा था testosterone के लिए, and because of that there was weight gain. So in the first week of what we did a detoxification. उसका 8 किलो कम हुआ, मगर not a gram of fat. I cannot sit down here and say, with my diet he lost 8 kilos. He lost 8 kilos of body water. Because of the injections, the body water, ascites was there, and there was a lot of edema, etc., and puffiness. He lost that body water. And we had given him a lot of fat burners, with natural things like cinnamon powder, etc. So his mother was so happy. Neighbor के पास गई, and she gave that same जो उनके लिए हमने recipe भेजा था, and she had made that in the house. एक डब्बी लेके neighbor के daughter को दिया. About 2-3 weeks ago, the neighbor woman called me up and said, madam, my daughter is behaving weirdly, vagera. So I am still wondering that I don't even know you. So what are you talking about? So she said, no, remember you have prescribed this for X boy. His mother gave it to my daughter. So I said, give me the history. That girl had a mental problem. She had bipolar and some other anxiety issues, vagera, vagera. And for that, she was being given medication to keep her calm. Totally different from that boy's thing. Now, when she was given this, that girl was getting absolutely hyper. More medicine was being given, allopathic medicine, to keep her calm. And fat burner hai na, isme weight loss hoga. So she was taking that powder also, without even knowing that it was detrimental, it was harmful to her health. A little longer, and it could have been even more, like she would have to be hospitalized, because this was not her powder. So that is the reason why I always say that I do not just give out quick fix remedies that sub le lo, ganne ka juice sab le lo, ghee sab le lo, because it may work for like 60-70% of the population, but what about that 30% who suffers because of my advice, right? So what we're going to talk about today also will be broad-based, and whatever you need to do is reach out to a qualified practitioner who knows your own history, who knows your personal history, and will be able to guide you in that particular way.
Correct, ma'am. So we can start with what exactly is blood sugar.
Okay, and how is it possible to lower that blood sugar? Because I'm sure everybody must be thinking, right? Wanting to know what exactly is it. So blood sugar or diabetes, or like what you would call diabetes mellitus, okay, is basically a group of metabolic diseases in which the blood sugar of a person is higher than normal. And this extra glucose, this extra sugar, will circulate where in the blood. It will not go into the different cells, it will circulate in the bloodstream, and it cannot be absorbed properly. That is when, over a period of time, the sugars constantly are higher and a person is diagnosed as having diabetes. Now, people you will know in your families, etc., who have high blood sugars for a very number of years. So there'll be someone who's diabetic in the family who is 15 years, someone who was diagnosed at 23, now he's 65 years old. So many years. They know exactly when their sugars are going high or low. But the important thing to know here is that over a period of time, unka body jo hai gets used to higher blood sugar levels. तो से हमारा जो नॉर्मल नॉन डायबिटिक लोगों का ब्लड शुगर नॉर्मल रेंज में 80 से 140 मैक्सिमम होना चाहिए और 140 खाने के 2 घंटे बाद. So 2 hours later, up to 140 is the normal. Now, someone who is recently diagnosed as diabetic or someone who is, very careful, etc., उनका 180 तक भी जाता है, 200 तक भी जाता है, तो immediately they will get a headache. They'll get some signs that the body blood sugar is high, okay, and it has to be brought up. But there are people sitting down, working in offices, dancing in clubs, whatever. उनका sugar 240 रहता है, 320 रहता है, and yet they are not feeling any signs or symptoms. So what does it mean? Unka body is tolerating that higher sugar levels. So agar unka, if for someone who is used to higher blood sugar levels, you try to bring it down very smartly and very quickly. Unko 140 में भी जो high है on the higher side of normal, if you bring their sugar to 140 also उनको चक्कर वगैरह आएगा जैसे कि low sugar patient पे आता है. So it is also important that for a dietitian or for a naturopath or for anybody, clap on the back कि हमने patient को 3 दिन में patient का sugar 380 से एकदम 100 तक लाया. But how is the patient tolerating it? ऐसे नहीं कि the पूरा दिन there is a disease spell, very low sugars, sweating, cold sweat वगैरह, and he can't even go to the office. Then what is the use of bringing his sugar down to 80 when he cannot function well? So the question here should be not about how to lower sugars. Yes, they can be lowered very quickly, but is it good for that patient's health? Is it better to lower it over a 2-month period of time, slowly from 320, slowly 280, slowly 220, slowly 140, then bring it down, as opposed to quickly bringing down the blood sugar? Is it going to be harmful to the patient or is it going to help the patient? So that is something that the practitioner needs to understand.
Okay. So, ma'am, so there, like you said, there are people who are constantly above 240, 250, but still doing all the activities. So, is it
Yes.
okay to have like remain in that field, or is it like in longer term it is harmful?
It is definitely over a period of time. See, where is the sugar? The sugar is in the blood. Where does the blood go? The blood goes to every organ. So over a period of time, unmanaged, uncontrolled diabetes जो होता है, वो सभी organs को harm करेगा. So from kidney से लेके peripheral nervous system यानी कि घुटनों तक, from eyes to the brain, heart, every organ can deteriorate or its functioning can reduce because of these high sugar levels. Hence, we say that it is important to keep it under control. ऐसे नहीं कि आप चल रहे हैं, फिर रहे हैं, you can function properly. It's okay, keep it at 320. No, I gave the example of 320 ताकि लोगों को people understand कि sugars ज़्यादा होने के बाद भी, despite that they can function, but it will, over a period of time, it will affect every organ in the body, from the eyes to the feet, from the brain to the heart. Every organ gets disrupted, the functioning. And that is why it is essential to slowly bring the blood sugars down.
Okay. So, ma'am, coming on the question that what foods can help lower blood sugar?
Okay. So, again, there are so many foods that can lower blood sugars on a daily basis. But top of the hat, when you look at, what is the one thing that I can do to keep my sugars down, it is the soluble factor of soluble fiber, which is present in so many foods. Okay, everything from your oats, barley, okay, legumes, यानी कि सभी dals, fruits, all of these can, and I know that you'll ask me next, ma'am, fruit खाना चाहिए कि नहीं खाना चाहिए. We'll discuss that little later. But
Correct.
fruit में भी soluble fiber रहता है, and ये soluble fiber helps not only keep your blood sugars down, keep blood sugar नॉर्मल में रखता है, मगर इट ऑल्सो हेल्प्स टू ब्रिंग डाउन टोटल कोलेस्ट्रॉल. आपके कोलेस्ट्रॉल, एलडीएल लेवल्स, ट्राइग्लिसराइड लेवल्स, इट विल ऑल्सो हेल्प टू ब्रिंग ऑल दीज लेवल्स डाउन. नाउ ये तो सॉल्युबल फाइबर जो फ्रूट्स में है, वेजिटेबल्स में है, बार्ली में है, ओट्स में है, लेग्यूम्स में है. अपार्ट फ्रॉम दैट, कुछ चीजें जो हमारे किचन में हमेशा रहता है, which also help to bring down the blood sugars. But again, when you're taking that, please speak to somebody who knows what tablets you're taking, what other medicines you're taking. If you have epilepsy, if you have migraines, आप कुछ ले रहे हो उस समय, तो हानिकारक नहीं होना चाहिए ये कॉम्बिनेशन. ये आपके मेडिसिन और जो नेचुरल पदार्थ है. So what are the other foods that can bring down your sugar? Everybody knows of flaxseed, मेथी का दाना, kasuri methi, okay, ginger, garlic, all these, even coffee, but decaffeinated coffee, and not too much of it, 1 or maybe 2 cups of decaf coffee. Then karela, karele ki beej, sabji वगैरह. Apart from this, anything which is high in magnesium can bring down your sugars. So what is high in magnesium? Nuts, okay, seeds, जैसे कि pumpkin seeds, melon seeds वगैरह can also help slowly bring down your blood sugar. Then anything which is high in chromium. Chromium is another mineral which helps, chromium picolinate, which helps to bring down blood sugars. वो तो you find it in egg yolks, coffee, nuts, any kind of whole grains, broccoli, green beans वगैरह. And if you're non-vegetarian, meat or shellfish में भी chromium रहता है. But again, the question mark is कितना खाना चाहिए. So this is your lifestyle, this is your cholesterol pattern. तो अभी आप 100 ग्राम लीजिए या 2 टेबलस्पून लीजिए. हमने कहा कि nuts is a good source of magnesium, right? तो इसका मतलब नहीं है कि you go into your refrigerator, you go into your pantry और take a big मुट्ठी भर पिस्ताशियो या काजू लिया और आपने खाया क्या ताकि आपके blood sugars कम हो. No, because then your cholesterol levels can also go up. So judiciously eating according to what your body requires. That's the most important thing.
Right, ma'am. So ma'am, like you said, in coffee in between, and suppose like आजकल बहुत ट्रेंड है कि शुगर फ्री प्रोडक्ट्स आते हैं, कि शुगर फ्री पेस्ट्री मिल रही है, शुगर फ्री केक, sugar free ice creams. So are they safe? Can we take those products?
Sometimes we're shocked, when we go to a, like you said, ice cream parlor या dessert place वगैरह में, sugar free, fat free, gluten free, you name it, सब में है, and the cake is looking so delicious. And what exactly is in it? Chemicals. So that is the saddest thing, okay? So when you ask, is it safe to consume that sugar free? All research that is going on worldwide, सिर्फ हमारे इंडिया में नहीं, worldwide research जो हो रहा है, shows that there are many harmful effects associated with all your artificial sweeteners. जो भी chemical based है, they have a lot of toxic equations to them. So there can be a lot of things associated with memory changes, associated with palpitations, etc. And there is a lot more research that is still happening. So health conscious groups worldwide are still saying that it is always better to eat small amounts of honey or jaggery, okay, small amounts, as opposed to eating a chemical sweetener. Or the other thing would be, don't have such strong coffee that you feel the need for a sweetener, because that sweetener is going to mess up your health more than that small amount of the actual sugar. So when we tell patients and they bring to us, the whatever packet of America se laye, Zurich se laye vagera, that this is the best, the purest form vagera, but it is a packet of chemicals harmful to your body. So most of the time, it is always better to stay away from the artificial consume smaller amounts of the natural, and your health will not suffer.
Okay, so we can take small amount of honey and jaggery if you want
Yes, or even a
something.
little bit of sugar. Even
Okay.
if you feel that need, just a regular dessert as opposed to eating a sugar-free dessert, because mind में क्या रहता है कि अभी ये sugar free है, तो हम लोग 2 कप ले सकते हैं. Sugar free है, fat free है, gluten free है, ये free है, वो free. But you are not understanding that you are eating a ball of chemical, जो हानिकारक हो सकता है सिस्टम के लिए. तो इसीलिए when you know that it has sugar and your blood sugars are high, you will say नहीं नहीं मुझे इतना नहीं खाना चाहिए, तो आधा चम्मच या 1 चम्मच आप खाएंगे या 2 चम्मच खाएंगे. मगर जब द वर्ड
जी,
केमिकल सॉरी शुगर फ्री है, तो इमीडिएटली आप क्या सोचते हैं कि इट विल नॉट अफेक्ट माय सिस्टम, कुछ
गिल्ट
नहीं
फ्री हो
होगा.
जाते हैं हम अंदर से.
Guilt free, you think guilt free. They want you to think it's
Yes,
guilt free. But
yes,
food should never be about guilt. That's the most important thing. You have to eat with gratitude. You have to eat with a mind that is clear that this is something that is going to nourish your system. If you sit there and feel guilty about food, आप पानी भी पिएंगे तो आपका blood sugar high हो जाएगा, क्योंकि you are thinking and you are stressing, you are more worried about every morsel that you are eating. So you have to sit calmly and eat judiciously, छोटे amounts, not too much, but at the same time search for food or whatever which is all natural and which is found regularly in the home.
yes,
That's it.
right. So, ma'am, coming on the solutions for this, so can insulin cure diabetes?
So
Because we do
as
get
we
insulin
speak,
shots and everything. Yeah.
as we speak, unfortunately, there is no cure for diabetes. Okay, up till now, research is still going on. Worldwide studies are going on. New chemicals are being brought into the market, etc. But cure abhi tak nahi aaya. There is, yes, you can control the sugars, you can manage the sugars, you can keep them under 140. मगर जिस दिन या जिस हफ्ते या जिस महीने आपने छोड़ दिया, automatically your sugars start going up. क्यों? क्योंकि pancreas जो which is the organ that makes the insulin is not working properly. And if that doesn't have a cure, then nothing that you do or don't do will cure you of diabetes. So that is a myth that I am cured of diabetes. I know that you will ask me then, ma'am, how can diabetes be reversed? So the condition can be maintained. The condition can be managed. तो आपके sugars 140 से कम आप रख सकते हैं. And you can do this. We'll discuss that also. You can do this with exercise. You can do this with eating the right diet, eating at correct times, etc. But insulin will not cure you of your diabetes. Insulin taken on a daily basis or weekly basis, depending on the type of insulin or whatever you're taking, insulin can help you manage your diabetes. Keep it within the normal.
Okay. So it can help in managing. So what should we do to
Management.
prevent diabetes? That वो हो ही ना,
Again,
हम पहले उसको खत्म कर दें.
so family history में, if there is genetically you're predisposed to diabetes, घर में father, mother या auntie सभी को या grandparents को है, then there is a strong chance that you will get diabetes. But we have seen that in so many families, अगर समझो कि 4 बच्चे हैं, यानी कि दोनों साइड ग्रैंड पेरेंट्स को डायबिटीज है, पेरेंट्स को डायबिटीज है, हाउ कम वन चाइल्ड डजंट गेट इट और बाकी तीनों को होता है? Because there is another thing associated with diabetes, just not the family history, but also lifestyle, stress. Because sometimes the reverse भी होता है कि घर में किसी को भी diabetes नहीं है, yet the person gets diabetes. So again, lifestyle, weight, stress levels, etc., can predispose to diabetes. So taking a healthy diet, exercising, sleeping, most important, sleeping on time, well at night, getting your regular hours of sleep, de-stressing, doing anything to kind of meditate and reduce your stress levels will all help to prevent getting diabetes. If not immediately, but at least you can push the onset onto 70, 80 years of age, if at all it has to happen. So de-stressing is very important, sleeping on time.
ये सो स्लीपिंग आजकल नॉर्मली होती नहीं है.
That's exactly
मिलेनियल्स
right.
में ये है कि रात को जागते रहते हैं सारे. सो एंड इवन स्ट्रेस भी आजकल बहुत रहता है जॉब्स में.
Extremely stressed. Yeah.
So ठीक है, आफ्टर दिस अगर हमें डायबिटीज हो गई, अब देन हाउ डू वी मैनेज इट?
Yeah. So again, like I've said, like those kitchen herbs and spices, which you're again,
जी,
utilizing, etc. But you also have to remember, खाना बराबर खा रहे, पानी बराबर पी रहे, but yet why my sugars are going high? A lot of patients ask us, हमने boiled कद्दू खाया, roti bhi nahi li because carbs are bad वगैरह, and yet sugars are going high. So I asked once two simple questions. What time did you sleep at night? And they don't realize the connection. Sleep? No. Last night we were at a party या कुछ हो रहा था कि program हो रहा था या
correct.
office का काम हो रहा था तो we slept at 4 o'clock. If you've deprived your body of sleep, in no way, hormones are made at night. In no way will your blood sugars be normal. So if you're sleep deprived, if you've not exercised for a couple of days, if you have not rested well, and when I say rested well, I also mean de-stressed, your sugars go high. So that is also important, that not only taking those herbs and all that I recommended in terms of cinnamon powder, yeah, methi dana, sprouted methi dana, roj lena hai. Apart from this, there's drinking sufficient amounts of water, detoxifying, de-stressing, exercising. So these are the things that will help to prevent, and also once you're diagnosed, will help you to manage your blood sugars better.
So, ma'am, you said about sleep. Is it like we should have sleep only at night, or is it like if we can rest in between work also, that will also work?
Very good. You can sleep in between or take a short nap वगैरह, because then your energy levels are higher. So if you've noticed कि खाना खाने के 2 घंटे बाद आपको 10 मिनट का भी cat nap चाहिए, take it. But what will that do? That will increase your productivity. यानी कि आपके energy levels ज़्यादा होते हैं, and that is fine. But hormone production, okay, happens when you are totally asleep at night during that somatic phase.
Okay.
तो क्या होता है कि that is a crucial time to be sleeping between 2 a.m. and 5 a.m. And
जी,
because you are not disturbed at that time, and everybody else around you is also hopefully asleep. कोई washing machine नहीं चला रहा है कि mixer grinder नहीं चला रहा है. So your body and your
correct.
brain, your entire body is completely at rest. So when we talk about sleep, yes, through the day if you want to take 5 minutes and whatever, that is fine. But that extra sleep, that long period of time during which you go into a complete deep sleep, and your body then starts producing all the hormones, आपके cortisol levels कम होते हैं because you have slept well,
जी,
is that night sleep. So that crucial sleep which is needed is the night sleep.
night sleep. Okay. So, ma'am, is it possible to reverse diabetes? Because you gave an example that the 320 level coming to 100. So,
Yes.
if we want to do it slowly, is it possible to reverse it?
Of course, it is possible to reverse it, right? And keep it constantly below 140 or below 200, 120 वगैरह. It is possible. But if it is done and 3 महीने के बाद बराबर में आ रहा है, या आपके HbA1c या 3 month level जो टेस्ट होता है वो 5.5 के नीचे होता है, then it is possible that you can say reverse हुआ है. But every 6 months initially for 2-3 years, every 3 months, every 6 months आपको टेस्ट करना चाहिए. टेक योर
जी,
3 month एवरेज HbA1c का टेस्ट करना चाहिए, या आपके फास्टिंग या PP लेवल्स टेस्ट करना चाहिए, क्योंकि इट इज अ मेटाबॉलिक डिसऑर्डर, राइट? तो हो सकता है कि 6 महीने के बाद अगेन योर शुगर्स हैव स्टार्टेड गोइंग अप. सो रिवर्सिंग इज पॉसिबल, बट ऑल्सो नोइंग दैट दीज आर माई शुगर लेवल्स. देखना है कि वापस भी 6 महीने के बाद, एक साल के बाद, आर दे इन द नॉर्मल. Then you continue doing whatever you're doing. If you're exercising, doing yoga, pranayam, whatever, and it has worked for you, continue in that manner. Don't say कि मैं 6 महीने के लिए योगा करने वाला हूँ और उसके बाद कुछ नहीं और भगवान will take care of me. Because it is not possible that after a diagnosis is made, it can go away without you doing anything. So health is in your hands. You need to take the onus of your good health in your own hands and say, this is what I have to do. Irrespective of what everyone else is doing, I need to take control of my own health. So reversing is possible, but also for you to know that 6 महीने के बाद, 3 साल के बाद, I'm testing, I'm checking. And yes, it is normal, then praise God and continue that way. But if it is slightly going higher, then quickly start working on bringing things down.
Okay, so ma'am, in this H1 A1C test,
HbA1c.
is it HbA1C test? So is it like it has to be below 5.5 to be in a normal range, or there are people, I have seen people who are in 6 to 7 range, but they are living a perfectly normal life.
Yeah. So non-diabetic nowadays is preferably kept below 5.6. The minute the person's blood sugars or the 3-month average is 5.8, 5.9, so how will you know that, people are scared about it? Insurance companies first increase your premium. क्योंकि उनको लगता है कि
अच्छा,
ये इनको डायबिटीज होने वाला है, आज नहीं तो कल, कल नहीं तो 3 साल बाद होने वाला ही है, तो प्रीमियम बढ़ता है. सो दैट शुड बी अ रेड फ्लैग कि
pre-diabetes.
I am paying more insurance because they think that I'm going to get diabetes. But jokes apart, what we also need to understand is that 6 to 7, once a person has been diagnosed as diabetic, so 6 to 7 में के बीच में अगर if they keep it, medically it is considered as good diabetes management. But you don't want to sit there and think medically it is concerned good. What is good for me? So keeping it below 6 is always essential. Now, keeping it below 6 by walking, by exercising, by eating correctly, by drinking water sufficiently, by stressing less, by sleeping more, by meditating, whatever is absolutely fine. But if that 6.2 आपको ज्यादा stress करने वाला है, then that also is going to be harmful to your body in the long run. So that's why we say that keep the HbA1c below 6. Below 5.5 is excellent, because then you know that कुछ stress या दिवाली हो गया या New Year's party वगैरह, तो in that 3 months या holiday हुआ उसी समय, तो if it goes up, तो 5.5 से 5.9 तक जाने वाला है ना, 6 तक
Okay,
जाने वाला है. At least it will not go to 8.5. So that is why
correct.
keep it slightly on the normal lower side.
So just for our viewers, HbA1c is average of
The
3 months
3 months
blood
should,
sugar levels.
yeah,
So ma'am,
3 months.
5.5 would be equivalent to what number in that sugar?
So
100?
when you are looking at 5.5 is generally between 120, 124
Okay,
average पूरा दिन का
okay,
average.
got it. ठीक है. So ma'am, people do say that if you want to control your diabetes or prevent diabetes, we should stop eating carbs and reduce weight. So does that help in reducing, lowering down sugar level?
Again, going to give you one stupid example. आपके घर में एक बाई आती है काम करने के लिए,
जी,
बराबर. If you have a driver, तो ड्राइवर ड्राइव करता है
जी.
गाड़ी को, ही टेक यू
हाँ जी,
फ्रॉम लेट्स से फ्रॉम दिल्ली टू मीरठ और वेरेवर. एंड आपके घर के बाहर एक चौकीदार रहता है. I'm giving
correct.
three people,
हाँ.
right? कभी आप कहते हैं मेड को कि आज चलो, आज आप गाड़ी ले लो और हमको मेरठ तक लेके जाओ? नहीं,
नहीं,
बिकॉज शी
correct.
डज नॉट डू. या वॉचमैन को बोलते हैं आज आप चपाती बना लो भैया, हमारे लिए 10 चपाती बनाओ.
Never
डू यू
happens.
आस्क योर वॉचमैन आज चपाती बनाओ? नहीं. सो लाइक दैट वे यू विल नॉट टेल द
वॉचमैन भी अपनी वो भी
ड्राइवर.
वॉचमैन वाली जॉब ही छोड़ देगा.
हाँ, तो ड्राइवर को आप नहीं बताएंगे कि आज भैया छुट्टी ले लो ड्राइविंग से और आज आप वॉचमैन के कैबिन में बैठो पूरे दिन. नो. व्हाई? क्योंकि इन तीनों का एक्शन जो है, रोल्स जो है, स्पेसिफिक होते हैं. तो सिमिलरली हमारे बॉडी में carbohydrate, protein or fat, 3 nutrients have a specific role to play. Okay. जो फैट होती है इट्स रिक्वायर्ड इन सर्टेन अमाउंट्स फॉर प्रोडक्शन ऑफ हॉर्मोन्स एक्सेट्रा, टू मेंटेन lubrication of all your joints and to maintain the suppleness of your skin. So fat has a role. I'm not saying eat 10 किलो घी, but I'm just saying that small amounts of fat are required. जो fat soluble vitamins होते हैं जो हम खाना से खाते, I mean like we eat
जी,
through food, has to go through a fat molecule. Okay. प्रोटीन्स का भी रोल होता है, सभी को मालूम है. फ्रॉम योर हेयर टू योर स्किन टू योर नेल्स टू एवरी फंक्शन इन योर सिस्टम, प्रोटीन हैज अ रोल.
जी.
Similarly, carbohydrates have the most important role. As we are talking, आपका brain, मेरा brain, our brains are functioning, right? Our heart is functioning. Every organ in our system is functioning. That's why you and me are both alive and doing this call together, right?
Yes.
But where is the energy coming from for all these organs to function? And most importantly, for my brain and your brain to function, where is the energy coming from? Glucose. And what is
Yes.
glucose? Carbohydrate. So when people say carb mat khao, weight kam ho jayega, diabetes कम हो जाएगा, etc. They do not understand that when they take a blanket ban on carbohydrates, what will then happen is that sugar levels will come down. Of course, it is but natural. Blood sugar levels will come down. Weight, half kilo, 1 kilo, 2 kilos will come down. But your general functioning, your brain functioning will go. Because jitna bhi protein khao, the glucose has to energize the brain. The glucose has to be there to energize the vital organs in your system. So without that, over a period of time, 3 दिन carb mat khao, चौथे दिन 4 days carb mat khao, एक महीना carb mat khao, you will notice that चिड़चिड़ापन, like people start getting irritable, angry, they start forgetting their work, they're not able to work properly. That indicates that bhaiya, you are eating something lesser than what your body actually requires. So what are the carbs? There are good carbohydrates and bad. Though we don't like to classify food as good and bad and guilt and non-guilt, etc. There are carbohydrates which are slow acting, जिसमें ज़्यादा फाइबर रहती है, तो आप एक चपाती खाओ जिसमें ज़्यादा भूसा हो, you put the wheat germ, etc. whatever. High fiber चपाती आपने लिया, 2-3 घंटे के लिए सटाइटी वैल्यू, यू डोंट गेट हंग्री. मगर उसी समय ब्रेकफास्ट टेबल पे अगर आपने चपाती या पराठा नहीं खाया, इंस्टेड ऑफ दैट यू वेंट एंड ईट कैंडी फ्लॉस, sugar, plain sugar, or you took caramel and you ate caramel या हनी लिया, तो आधा घंटा या 15 मिनट के बाद that glucose is very quickly absorbed and you're hungry again. So when people talk about carbs, it is not all carbs that are bad for you. It is these quick acting sugars, the ones that are metabolized very quickly, which are broken up very quickly and very fast get digested, absorbed and assimilated in the body. Those are the carbs you need to avoid. So anything which has high amounts of sugar, which has low fiber in it, is the carb that you need to avoid. But eating a paratha, for example, which has lots of doodhi vagera, lots of vegetables in it, you add 1 tablespoon of flaxseed ka powder, या phycelium ka husk vagera, you have increased the fiber content of your chapati. अब 2-3-4 घंटे के लिए you will not feel hungry. That means it is taking a long time to get digested. So sugar release very gradually happens, and as a result, आपके blood sugar में spike जल्दी नहीं होने वाला है. So that is the difference between taking a high fiber carb and a low fiber or a zero fiber carb. So again, your question is, should we avoid carbs? No, you should not avoid carbs completely, but you should avoid the carbohydrates which release sugar immediately into your system. आप hospital गए, you've seen so many patients on glucose. उनको ग्लूकोज क्यों दिया जाता है? चपाती देना चाहिए ना. When they are very unwell, why are they on a drip of glucose and not on a chapati? Or they're not on a paratha or a puri? Because glucose जो है immediately does not need to get absorbed. It does not need to get digested. It's straight away absorbed into the bloodstream. So accident patient, anybody who's really, really ill does not need to sit down and start digesting the food. So that is why a glucose drip is given. उनको 2-3 चपाती हाथ में नहीं, like they don't give them 2-3 chapatis and they अभी खाओ भैया, आपका ग्लूकोज ज्यादा होना चाहिए. So the understanding is slow carbohydrates. Carbohydrates which break down slowly in the system are the ones that need to be consumed. You need to avoid the sugars from direct sugar sources, and that will help you to maintain your weight, maintain your blood sugars, maintain triglyceride levels, and so many other things in this.
Right. So, ma'am, is it okay if we are taking direct sugar in case of sports recovery, like running marathon, we do take glucon or ORS?
Yeah.
So, is it okay?
For that period of time, yes, because the liver throws out glycogen. जब हम लोग sports activity करते हैं वगैरह, so the liver will also throw out some amount of the reserves of glucose. That glycogen is thrown. That's why we can, when that whistle goes and the fellow says 1, 2, 3 and or 3, 2, 1 and run, you run because you have that extra glucose. So even sports recovery, you require it. But again, when you're not doing an activity and you're sitting and eating barfi and whatever else, it's but natural that your blood sugars will go up.
Okay. So, ma'am, like you said, we can have rotis and for slow consumption once digestion takes place.
Slow
and then
release.
it comes into
Slow
your system.
release of sugar.
Yeah. So when people are traveling, so it is not possible to have rotis and paratha everywhere. So what are the good foods they can carry with them which are instantly available but not bad for health
So
in case
that
of
goes for
diabetes.
anything. That not only has to be travel, that is even if I want to go from here to a nice restaurant in town, right? So as a diabetic, what should a diabetic be doing, or what should someone who wants to eat healthy be doing? Very, very simple thing. So without, it's like a no-brainer. If there is a fried puri available and there is a khakra or a chapati or whatever available, so you will choose something that has a slow release. So you will choose salads without the dressing. You will choose to carry with you thepla, khakra, whatever is dry foods which you can eat when you feel your blood sugars are coming down or when you're hungry, etc. Sometimes even a simple sandwich, there's lots of vegetables, is going to work the same way. But if you're going out to eat, whether you're in your same city or you're traveling from Delhi to wherever it is, it just means that if you are choosing well at a restaurant, so the minute you go into a restaurant and you order a salad, tell him that please keep this dressing side mein aap rakho. Why? Because most of the time the dressings are all this ready mayonnaise, etc., which they just
Yes.
squeeze from bottle, put it over the salad. Again, that has so many chemicals and a high fat content. So that is why you ask for your salad plain, dressing separately. Then if you're ordering something like a grilled chicken as opposed to a butter chicken, then the grilled chicken is naturally going to have a lesser fat content. Okay, so all your options should be something that you look at and you know that, okay, even if you can't make out, you don't know anything about cooking, just touching the food, if there is oil on your hands,
Ji.
if it has a high salt content or a high sugar content, you are definitely not going to. So don't stress about it. But at the same time, realize that, instead of opting for a fried chicken, I can opt for a grilled chicken. Instead of opting for a paneer which is fried in whatever, they dip it in papad vagera, papad ke tukde vagera, and they make it crunchy. Instead of that, I can order a dish which has plain pieces of paneer in it. Gravy mein plain pieces. So that is how you learn over a period of time. But again, if there is nothing available and it's only fried and only oily and only high salt, high sweet content, etc., again you have to remember that you can't starve. So you're eating smaller amounts of that, but make sure you work out immediately, as in within the next 2 hours. You
Correct.
walk your 10,000 steps that day. You try to run some form of activity. You drink methi ka pani if at all you have it. You take a chamach of cinnamon powder, if you have no other complications or not taking any other medication. And that will still help to bring your sugars down as opposed to kuch nahi mila to main nahi khane wala, fried or other foods. So you will try your best on those occasions to eat while thinking.
Okay. Right, ma'am. So, ma'am, I have received some questions from viewers that will insulin make you gain weight?
Insulin will bring your blood sugars down. But unfortunately, in some patients, it makes them gain weight. Now, why does this happen? Generally, I'm not talking about juvenile diabetic, जो बच्चे होते हैं और उनको diabetes है और उनको लेना ही है insulin, no other therapy will work. I am talking about an adult who is put on insulin. Most of the time, 95% of the time or 99% of the time, पहले तो diabetologist will put them on medication. या पहले बोलता है lifestyle change करो, exercise करो, देखेंगे. फिर उससे if it's not happening, so they are put on oral hypoglycemics, यानी कि tablet लेके to bring down the sugars. If that doesn't happen,
Right.
then the diabetologist puts the diabetic patient on insulin. But during that period of time, while control of sugar is not proper, there's so much of sugar that's circulating in the system, and the high blood sugar levels sometimes cause a major loss of weight. यानी कि sugar ज़्यादा होती है, वो लोग बराबर से खा रहे हैं, मगर stress whatever is, and they have lost weight. A long-standing unmanaged diabetic will show some weight loss. So suddenly, they have become very skinny. Not healthy skinny, but very
Skinny.
underweight and weak and de-energized, etc. The minute they're put on insulin, medication, the doctor has given them the maximum medication in terms of tablet that they can take. उससे भी कम नहीं हो रहा है, then he puts them on insulin. Insulin will quickly bring their sugar readings into the normal range. But because it's now working for them and it's the sugars are coming into the normal range, and apart from this, kabhi normal se kam bhi ho raha hai, that's the time when the patient will start feeling a little more hungry, and they will eat food. So they will eat more food, or insulin lena padta hai. Again, that whole cycle starts. And
Continuous.
in this time, they will see कि अगर समझो कि 3 महीने में 15 किलो घटा, क्योंकि not because of exercise, not because of eating properly, but because शक्कर ज्यादा हो,
जी.
sugar levels are high in the system,
Mhm.
and that is why there is weight loss. Then the minute the sugar levels are normalized with insulin, the weight goes slightly higher. Now that is not cause for concern. If you immediately start exercising more, you sleep on time, eat your meals on time, eat smaller meals, manage your sugars that way, then even with insulin, people don't have to get fear that, mera 15, it's not possible that 15 kilos go up, but 2-3 kilos that go up initially when you're on insulin can also be managed.
Okay. So my next question is, can your menstrual cycle or going through menopause affect your glucose levels?
Again, just like how insulin can make you gain weight, can in some cases make you gain weight. Unfortunately, when a woman's body is making estrogen and progesterone, ये जो female hormones रहते हैं, those can affect the blood sugar levels. So period time, when a woman is getting her period and she's diabetic, she's diagnosed as diabetic and she has her period, her body is making progesterone, or her body is making estrogen. At those times, there can be a spike in the sugar levels. Then menstrual cycle ke baad, when she goes into menopause, and again there is fluctuation in the estrogen progesterone levels, again there can be spikes and lows in the blood sugar levels. It is possible that it happens, but it's not something like the end of the world. It can also be managed at that time. So at that time, simply taking, if she doesn't have any other condition, simply increasing her intake of flax seeds or increasing her intake of soluble fiber on those days of the month can also help to stabilize the blood sugar.
Right, ma'am. So ma'am, coming on to the favorite topic, आपने जो starting में कहा था कि we will talk about fruits last में. So please
Okay.
fruits के बारे में बताइए, because fruits do because people have tendency, अगर हम कुछ भी करना चाहते हैं अपनी health में ठीक, तो we can eat only fruits. So is it a good approach
True.
for managing
Okay,
diabetes?
that's one thing, that eat fruit and you will be healthy or whatever else. But diabetics के लिए, if a diabetic is sitting with a small apple, everyone is like apple खा रहा है. But if the diabetic is not eating dessert, समझो कि किसी के शादी में गए हो, and the diabetic is saying नहीं नहीं मुझे नहीं खाना है chocolate सूफले, या मुझे चीज केक नहीं खाना है, there'll be 10 people who say नहीं नहीं थोड़ा थोड़ा खाओ, nothing कुछ नहीं होता है. But when it is a simple fruit, he was, oh, आप fruit खा रहे हैं, fruit is so bad for diabetics. But the bottom line is one thing. Fruit has fruit sugar which gets absorbed in the system. But apart from that, fruit also has vitamins, minerals, and जो fiber हमने बताया था, soluble fiber के बारे में, fruit also has soluble fiber. All things that are good for a management of the blood sugars, management of weight, etc. When you are eating an orange, आप एक orange खाएंगे. Okay, you eat 2 oranges at a time. Someone came in from Nagpur and really nice oranges, आप 2 खाएंगे. Will you eat 4 and 6 oranges? At one time, will you eat 4 or 6 oranges? No. You say, who's going to sit down and eat 6 oranges? I will feel sick after that. मगर आपके 1 glass orange juice में, there's a minimum of 4 to 6 oranges, and there is no fiber. Because the juicer is very fancy and it removes all the fiber and gives you that fresh glass of orange juice. So, समझो, example की तरह, suppose each orange has 12 grams of sugar. आपने खाया वो orange, and what will happen is that your body is able to break down that 12 grams of sugar. मगर आपने juice लिया, 12 into 6, you do the maths. That much more sugar you're taking at one time, right? And no fiber. अपने juice पिया, you're taking the extra sugar, but fiber bhi nahi hai. So, but naturally your sugars are going to go high. Then everybody says, don't touch fruit, fruit is bad and whatever it is. But the way you've eaten the fruit, या lunch या dinner के तुरंत बाद dessert चाहिए तो dessert नहीं खाना है क्योंकि diabetic है, तो people take fruit. Okay, so what we always say then is fruit is essential. 1 to 2 fruits a day as a diabetic is what you can consume. But please do not consume the fruit with the meal. कि ब्रेकफास्ट के तुरंत बाद आपने पूरा एप्पल लिया, लंच के तुरंत बाद आपने 2 ऑरेंजेस लिए, डिनर के बाद आपने अंगूर लिए, because then what will happen is that your blood sugars will go higher. First, your body is already trying to break down chapati, rice, जो भी आपने खाया, उसका sugar their body is trying to work at breaking down, and then उसके ऊपर आपने fruit लिया. So then the question comes कि fruit फिर कब लेना चाहिए? We always say that meals, 2 meal के बीच में, breakfast और lunch के बीच में जो 11 o'clock का gap हुआ, या lunch और dinner के बीच में 4, 5, 6 p.m. At that time is when you should take your one fruit. So it will not bring your sugars up. Your body can digest it properly, and most importantly, after 2 hours of a meal or 3 hours of a meal, you generally feel a little hungry because you've digested that food. So that is the time you put that orange in, or that little bit of pineapple, or whatever fruit you're eating. And it's nothing like, you have to only eat 2 fruits because you're diabetic. Yes, if you have a diabetes with a kidney ailment, there are fruits which you have to avoid eating totally. But generally for a diabetic, a small portion of any fruit is, including mango, is permissible.
Okay. Right, ma'am. Thank you so much for your valuable time. I'm sure viewers ने बहुत कुछ learn किया होगा. Viewers के लिए do like our content, and if you know someone who is diabetic,
Definitely.
do
And
share this video.
just one more thing, not for anything else, we do have a book on diabetes. So everything which is explained is just called blood sugar and spice. क्योंकि spices जो हमारे kitchen में रहते हैं, so that is something that when should I take this? Should I take या मेथी कैसे लेना है? It's a very simple, easy to understand book on blood sugar that we came out in way back in I think 2013 or 14. But it's like a Bible for a lot of diabetics. वो देख के, and there are lots of recipes वगैरह inside. So whatever you're doing, consult with somebody, any qualified dietitian, any qualified nutritionist who will be able to guide you as per what your current condition is.
Yeah, so I was coming on that point only कि आपके जो 3 books हैं, and along with that आपको, if people want to contact you, we will put all the details in description so that they can contact you directly also, and even if they want to contact through Yuvaap, they can just let us know, we will connect you with them.
Definitely, that's fine. But like I said again, not only me, any qualified practitioner in any city, anywhere in the world, the person has to be a qualified practitioner simply because then he or she understands biochemistry, understands nutrient drug interaction, and is then able to best guide you.
Yeah, and we should not go by the WhatsApp University.
Sorry, unfortunately, we should not.
Yes. So thank you so much, ma'am. Thank you so much for your time.
Most welcome. And I just hope all the viewers are blessed with good health always.
Thank you so much, ma'am. Namaste.
Most welcome.